Welcome, everybody, to the Lo que Importa Latinx video podcast. We're happy you're here to join us. We do have some important updates for you, so thank you for joining.
And today is a special day because we are actually starting this Lo que Importa, what actually matters. And this actually for you and only for you, and we're going to be trying to replicate and answer any questions that you may have. And today is a special day because we know that we're starting to see our kids going back to school, our youngsters part of the precious part of the community, and of course, COVID-19 is watching us. And we have a lot of answers for you.
And during this whole pandemic, I feel that people have at times felt that they haven't had a good chance to ask a doctor a question. They felt that information has been hard to get, especially the questions that they have that may not be on the news. And so the real reason why we're here right now is so that you can send in your questions and we can make sure that you're getting the most up-to-date, reliable information when you need it the most.
And that's completely correct, Dr. Turner Lloreras. The idea of this is, for example, right now that we can actually start vaccinating our kids above 12 years of age. We have a lot of questions, and, we have heard, I'm a father, and we have heard a lot of things all over the country about, is it safe? What does it mean that right now it's approved? The Pfizer vaccine, what do we know about that part? And let me answer a couple of things. For sure, we can vaccinate any kid above 12 years of age. The idea of this is that we have already have done it in actually on the million mark, more than the million mark. And we have seen how they are protected. They're not ending on the hospital. And most importantly, they are being, you're avoiding all the long-term COVID effects that they are horrible and decimate a lot of the community. Then right now, that's one of the things that we need to be seeing. The second thing that we're seeing is that right now, a lot of people were waiting to have a full approval from the vaccines, especially with the Pfizer one. Right now, we have it. Above 16 years of age, it is happening. Then if you were in doubt, now we know they're safe, effective, and they are approved.
Exactly. And it's a little bit worrisome right now because prior to recently, the majority of people being hospitalized were older population, our abuelos, our abuelas, our grandfathers, our uncles. Now, for the first time, we're really seeing a spike in the number of hospitalizations in children. And so we understand that you're worried and we understand that you want to get your children vaccinated, even those who are younger than 12 years old. But it's very, very important, urgent, that we follow the guidelines because we want to make sure before we vaccinate someone, we try to be as careful and as thorough looking through the evidence to make sure that this is the right time and this is the right vaccine to protect your loved one. And so as of right now, as Dr. Shapiro said, it is approved for those over the age of 16. But for those under the age of 12, we really can't recommend it right now. But most likely, this will be approved by the end of the year. And so once again, 12 to 17 is in the age group where we're in the safe zone. Those under 12 are going to have to wait until most likely the end of the year, although earlier is a possibility.
And we want to try to figure out what's a special dose for our kids and make sure that they're protected. And that's what we want, because we don't want to give a higher dose or a lower dose and not be protected, or actually have a higher dose and we have no idea what could happen. Then we need to be on the safe side.
Exactly. And just to clarify, so the vaccine's been authorized 16 and 17-year-olds since December, and now authorized for 12 to 17. Those under 12, we're getting close. We're getting to a point where soon an entire family will be able to say that they're vaccinated and not have to worry. We're also going to be in our next episode, going to be having conversations with family out there who have personal questions about some of the issues going on with COVID within their home. And we're going to be looking forward to having those conversations and sharing those with you.
Please, familia, right now there's a lot of misinformation and disinformation out there. This space is for you to create questions. Anything is game, and we are here to answer any question that you may have. And most importantly, we want to make it fun, efficient, and most importantly, share it with absolutely everybody around you. Then see you next time.